for our monthly Affordable Care Act updates for agents. As always, we'll take questions at the end, and so if you're familiar with your chat box where you can ask questions or raise a hand. The audio call or the webinar is also being recorded, so you can access it on our website if any other associates need to get to it other than this morning. So here's what I was thinking a lot about all the agent visits that I've been conducting over the last couple weeks, and I'll continue throughout the summer. So if I haven't seen you yet or been to your place, I'm on my way, or give me a holler to make sure that we get something set up. But I got to thinking about, what do you really need to know to stay committed and work in this industry? And I think there's a baseline of knowledge that we all need to have. And so what we're going to go through in the next couple slides is a little bit of a quiz. Now, you're on your own, but what I want you to do as we tick through some of the things in the individual market and in the group market, what do you know and what don't you know in terms of facts about the Affordable Care Act? So we'll do that, and then we're going to talk a little bit about how are you going to market. Now is the time that you should be planning, thinking about how you're going to be touching all your customers. We'll talk about what's coming up, of course, with group renewals, individual open enrollment, as well as the Medicare annual enrollment period. So, and then we'll just end with a little bit about what lies ahead and our ever-changing industry. So we say what we know today, and here's my disclaimer, because we'll share what we know today. And there are some great resources out there. I hope that KHI, what we hope to do is pull some of those together for you in these monthly calls. But feel free also, I'll show you a couple things at the end that both NAIFA and NAHU, those are the two organizations that KHI belongs to. I know many of you belong to the Big I, but those three organizations are really staying, hopefully keeping all their members up to date, and that's what we're doing at NAIFA and NAHU as well, and so I've got a couple updates from both of those organizations. So let's get started on what I call things you need to know, and we'll start with the individual market under 65. So we know this, right? This hit the newspapers this week, that Wellmark will not be in the public exchange or the marketplace in 2016. And it was interesting because an agent emailed me this week once this word came out and said, does that mean Wellmark won't be selling ACA policies? So the answer is obviously no. Wellmark has ACA policies. They're just not in the marketplace where people go to get their subsidies. Know also that Coventry and United Healthcare plan to be in the individual exchange in 2016, which is really great news because since Co-Opportunity left the market, and we believe competition is good. And so we've also heard a little bit of rumor there might even be another individual player come into the market in 2016. So remember, too, that when a company comes into the marketplace and they're selling their policies in the market, they must also sell them outside the market, the same policies. So Wellmark, though, it doesn't go both ways, right? If Wellmark sells ACA policies, they don't have to commit to selling inside the marketplace, which they haven't. And then don't forget about special enrollment periods. We have a cheat sheet for that. If you don't have that, you should have our cheat sheet and have it somewhere handy in your office so that when somebody walks in and says, can I buy insurance now? You pull out your handy-dandy cheat sheet and talk about special enrollment periods, because otherwise, no, you can't buy until, notice, our next open enrollment period, November 1 to January 31. So hopefully as we're going through here, maybe you're checking these off, going, yep, I knew that one. Yep, I knew that one. Okay, maybe didn't know about that. And then make sure you know that the marketplace is for people who qualify for a subsidy that fall below 400% of the federal poverty level. And of course, even some of those right at 400 or right below 400 may not even qualify. The healthcare.gov is, don't forget to sell on that. You need to be certified, and we can help you with that if you're thinking about getting into that market and you haven't maybe dipped your toe in yet. Again, if you're committed to this market, I think it's going to be, you're going to be hard pressed not to, get certified in healthcare.gov just because you're going to get people that are going to come and ask you. Now, again, maybe you partner with somebody else and you refer that business away, but so healthcare.gov. It's funny, that website, some people just don't even can't remember the website that you need to go to for healthcare.gov, and that's the official exchange. And as you know, Iowa is a federally facilitated marketplace. Okay, and that's more about that later. And all plans are guaranteed issue. I know you know that, and you should know that, right? The only things that we need to get a quote are date of birth, address, and do they use tobacco or not, and then, of course, what additional family members want to be quoted. The penalty is assessed on the tax return filed the following year. We had a whole separate slide. If you attended spring training with us in Wellmark this spring, we had a great slide, and we've got that PowerPoint out on our website now that Wellmark did. It's a great slide because it shows what the penalties are, and that's another good one to have and just print off and have in your drawer so that when somebody comes in and says, "Well, I don't have insurance, but I'm thinking about buying it," or whatever, you can share with them what the penalties are. But again, not to be assessed until the following year. Subsidies, of course, are determined by income, the number in your household, and how old people are, right? And then the subsidies are trued up on the following year's tax return. And that was kind of an interesting thing, right? This year, when people started sitting down to do their taxes in 2015 for 2014 and realized, gosh, I guess I was supposed to buy health insurance or I'm going to be assessed a penalty. And then the government decided for all those people that were hiding under a rock that didn't know, we're going to give them a special enrollment period. So that was what we just completed April 30th, and then some of those people had some for 5/1 effective dates. So anyway, so that's, caution there when you're playing in the marketplace. So it just takes more of our diligence as agents to make sure that we are coaching our clients properly, to make sure that if they're estimating on their income, they're estimating for this year, for example, or they're going to estimate for 2016, and that if that changes, they can, get to healthcare.gov. And as you guys know, many of us, our hands are tied in terms of what help we can provide for them, like without them being on the line. So hopefully we'll see some changes coming down in healthcare.gov on the portal so that they'll give brokers some access and maybe some things that we can do on behalf of our clients. But for the most part, so many of that, we've got to get them on the phone, or they just need to call in and report their change in income, or report that they've moved, or report that something's going on with their family or whatever, that they need to make changes. So it's just harder for us, right? And a lot of you say it's just a pain in the what. But anyway, it is what it is. So if that's your market, or you want to commit to that market, those are just good things to know. And then this last one, gosh, we've just been having go-arounds about how and when these plans need to be moved. And we'll talk about small group as well on the next few slides. But grandmothered plans, initially when this came out, and this is why we have these continual calls, because, something gets rolled out, like they said, all plans must be converted to ACA, right? All grandmothered plans must be converted to ACA by January 1 of 2016 is what they initially said, and must be moved by October of 2016. So the interpretation at that time was that individual policies would be moved by January 1, and all other groups or plans that renew would need to be moved to ACA no later than October of, they could keep their ACA, their grandmothered plans through October of 2016, but then after that everything would be grandmothered. Well, anyway, we learn now, as Wellmark has shared with us, that any individual plan that they all renew on January 1. And so with the January 1 of 2016 renewal, they will get to renew. These individual grandmothered plans will get to renew on January 1 of 2016 in their current grandmothered status, and will be locked in then, of course, in their plan until January 1 of 2017. So we've got some time with our individual plans. So it's not this fall that we need to be scurrying around and talking to our members about moving to ACA. That won't be for another year. And I think initially, like I said, we thought everybody had to be moved by January 1 of 2016, but it's individual grandmother plans moved by January 1 of 2017. So we'll get ready for the onslaught of all those, particularly Wellmark plans, moving to ACA a year from this fall for that January 1 of 2017 effective date. Now, having said that, I want you to remember that Coventry already really moved all their people to ACA a year ago. So this, like January 1 of 15, everybody was moved, and they were just mapped, right? They would get a letter, which I'm sure that's what Wellmark will do. They'll get a letter, all these grandmothered plans, to say, okay, here's the plan that you've been mapped to, or you've been directed to, that's most like what you have today, and here it is, and then, oh, by the way, here's your rate. And of course, a lot of us are concerned that rates are going to be higher than where they're at right now. So we'll have yet to see. But that's, we'll see how, it'll be interesting to see how you did. Feel free to shoot me an email. I think you'll get a follow-up email from this conference call if you want to give me a heads up on Lynn. I knew everything that you already told me, or I still picked up a few things. So let's go to the next slide on things you really need to know to play in this industry, in the group market. So, wow, I know there's so much confusion, so I'm going to try to lay this out so that it really makes sense. Because when your clients are asking you questions, it's like sometimes you'll get that, I'm sure, deer in the headlight look like, oh man, it's so confusing. So let's start out with the definition of small group. So they define small group as 1 to 50 employees. And we know that market size, 1 to 50, is age rated. The ACA small group defined as 1 to 50 is age rated. The definition is supposed to change to 1 to 100 on January 1 of 2016. And the big deal here really doesn't have anything to do with, do I have to offer coverage or not? Do I pay a penalty or not? That's separate. We're going to get to that. That's the next line on pay or play. But let's stay with the definition of small group. If this definition changes to 1 to 100, and it's expected to, although on Capitol Hill, I know there's been some talk and possible legislation to either delay that definition so that it will turn to that eventually, but push it out a year or two. But if it doesn't get delayed, what it really means is, how are those groups rated then? So because today we know 51 plus is still rated based on the demographic of that group, based on their claims history. That's the carriers have usually those 4 or 5 items that they use, their base rate, what they're seeing in their entire block. I mean, all these things go into determining the rates for those groups that are 51 plus. So can you imagine what might happen to rates when you move to a straight age-rated rating, if you will, on the group itself from 51 to 100? And we anticipate, once again, possibly, rates may go up again. And then we still have this issue that many carriers are not offering what I'll call those composite rates, or more like a community rating. So you get this 60-year-old that's going to pay, $800 a month, and then you get the 22-year-old that's going to pay, $200 a month. And this is concerning to a lot of people, and I think it's potentially burdensome for the small group employers. And of course, our job is to help them understand these changes. So let's stay tuned to what's going on. We'll keep you up to date, but just so you know that that's looming, okay? Then we move into the pay or play. And if you recall, this really, it's all about the what we call the employer shared responsibility. Now, I remember, gosh, a couple of years ago when I started launching these seminars for the Affordable Care Act, and we talked about pay or play, which is really a phrase that was picked up because an employer with the employer shared responsibility may or may not offer coverage, and then they wanted to determine, what is my liability? So what we'll call, if I play, right, in the market, if I play and offer coverage, then I'm great. But if I don't want to offer coverage, then what would I have to pay in terms of a penalty? So that's, the pay or play is referring to that. And remember, an applicable large employer is also one we call sometimes an ALE, applicable large employer. So that's whether or not an applicable large employer, then let's jump down to that next slide, is 50 or more full-time equivalents. Now, this is the only time that we use full-time equivalents, right? And so there's a calculator that we have, and if we have time, I'm going to go to the HR Solutions calculator and show you. But I've got it there in the next bullet. No, it's on khisolutions.com or khiagents.com. Either portal can get you to HR Solutions, and then you log in. If you don't have your login credentials, please send an email to Tricia at KHI Solutions, and she'll make sure that you've got it. If you think you got it one time and you're not sure what your password is, then just put in your email address and click Reset Your Password. And you can do that on the HR Solutions portal. If you have any trouble, just give Tricia a holler. Some of you that are new agents with us, please get your login to this, because it is so full of great information. But that calculator is out there. So if you're working with that group that they're not sure where they're at, are they an applicable large employer, meaning 50 or more full-time equivalents, you can help them with that calculator. And that is our job, to help them with that. So those are the tools that we're providing to you to make sure that they know, what size am I? And the reason it's important, you guys, is because, remember, below 50, they don't have to offer coverage. I mean, that's our company, KHI. We have, 17 employees, and we don't have to offer coverage. We do, but we don't have to. And we know we don't have any part-time people, so I know we're under 50. But there are some companies that have those part-time people, or they're teetering really close. They maybe have 30 or 40 full-time, and they do some part-time folks. So the other reason is not just am I applicable large employer or not, but because of some of the delay, they're calling it transitional relief, the companies that were 50 to 99 full-time equivalents did not have to offer health insurance January of 2015. So they got pushed out another whole year. I may be getting ahead of myself, but because I'm getting down there. So I'll kind of keep going down, and hopefully you're still checking your things off. Yep, I knew that. Yep, I knew that. So the pay-or-play requirements were delayed until 2016 for employer groups with 50 to 99, and the pay-or-play requirements for employer groups with 100 plus are effective January 1 of 2015. So remember, this is the requirement. When we talk about pay-or-play, it's figuring out how many full-time equivalents do I have to know if I'm supposed to offer coverage or not, okay, or pay a penalty. And on this, I've got a couple more slides for group market, but and I apologize for those of you that don't play in the group market. Hang with me because there's some other things we'll get to here, but this is all really important stuff. So grandmothered group plans will be moved to ACA after October of 2016. So here's what we've learned, that I was starting to, and Brenda and I was like, oh my gosh, do they have to all be moved? And we were freaking out because here it is in 2015. And if you've got somebody with an 11/1 or a 12/1 effective date, renewal date rather, if they renew this year, will they be able to renew, all the way through November or December of 2016, when technically that's quote unquote after, when they have to be moved by? And so what we're realizing is probably what most of the carriers are going to do is, and many of them already do, is offer an early renewal. So they'll either have a program to offer an early renewal. I've heard Coventry is looking at offering some 18-month rates, right, for renewals. You can renew your group early. So let's take that 11/1 or 12/1 group that renews 11/1 or 12/1 of 2015. They're good this year. They can renew. But next year, if they don't change their effective date to October of 2016, right, if they leave it at 11 or 12 of 16, they will get an ACA renewal, 11 or 12 of 2016. If they keep their renewal that date, they will have ACA renewal. But if they choose to, they can pull their effective date up to October of 2016, move it to that, and then they'll get another whole year into 17 that they'll be able to have that renewal. So then October of 2017, they'll have to purchase ACA. Now, having said all that, it was funny. Many people said, well, I could move my effective date now. Absolutely you could. You could move it now if you wanted to. But maybe the question is, why would you? What if this gets pushed out again? So maybe you leave it where it is this year and you renew as is, and maybe we just wait to see what happens into next year. And then if they don't, just know this, at least with Wellmark's guidelines, you have to notify, we will help you, but you have to notify Wellmark within 4 months if you want to change the renewal date. So if you've got somebody that has 11 or 12 November, December renewal date, and you want to pull them up to an October, and I'm talking maybe a year from now you want to do this, you have to let Wellmark know by June 1, because June to July, August, September, October, there's your 4 months. They need it 4 months ahead of time in order to generate the proper renewal with the proper rating, okay? So again, we don't have to panic yet. I was, because I thought all this had to be done by June 1 for an October. Yeah, okay. We've got another year. Take a deep breath. But just know that this is the funny stuff that's going on with when do we absolutely have to move. And as you know, most plans don't want to have to move and adopt the ACA, all of the components of ACA until they absolutely have to. Now remember, as you're having questions, jot them down, or you want clarification, we'll open up the lines at the end. Also in the group market. Now, this is such a hot topic. This is all about employer group reporting. And I will just tell you that, you can dig really deep into this. And I was last night just to get my wording right when I was putting the final touches on this presentation. So the IRS sections 6056 and 6055, I want you to just kind of, if you know this much about the reporting, the 6056 is requiring all applicable large employers to file these information returns to the IRS and provide statements to all full-time employees about the health insurance coverage that they offer. And this is satisfying the employer shared responsibility duty that each employer has if they're an applicable large employer. Okay? So just remember, that piece of reporting has to do with, am I compliant with the employer shared responsibility? Because remember, if they're not, there's penalties that'll be assessed. All those forms must be filed by February 28th of 2016 or March 31st of 2016, looking back at the 2015 year. And those two dates are different, you guys, just because if they file paper forms, then it needs to be in by the 28th. If they file electronically, they've got until March 31st. Okay? So that's that section of reporting. The next section of reporting talks about minimum essential coverage. And this is really, notice, this is what satisfies the individual shared responsibility. What the heck is that? Remember, this is really the individual mandate. This is the mandate that the government says all Americans, with a few exceptions, must have health insurance coverage, and it must meet a minimum level. They call minimum essential coverage. So guess what? All applicable large employers, okay, I'm going back to the ALEs, and don't forget, this also applies to those that are self-funded, regardless of their size. Then they take on this responsibility. Because anything under 50, the carriers are filing to the government for us. Individual and under 50 are all taken care of by the carriers. But any applicable large employer, okay, or self-funded are responsible for doing these reports. And this one about the shared responsibility must be filed by January 31st. Think of this a lot like a W-2. They have to generate something to every single individual so that they can take to their tax preparer and say, see, I had coverage, I had minimum essential coverage this year. So you see how those two are different. And I know this is so confusing, and I'll tell you this, KHI is not doing this for you guys, right? You're probably not doing it for your employers, and this is the big darn deal about why KHI chose to partner with ADP to help employer groups get their arms around all of this reporting. And I'll tell you what's really hairy is you might think, oh, that's not a big deal, and I see all the instructions here, and they'll just sit down and fill out the forms. Where it gets really hairy is, and I'll think we'll talk about it on the next slide, let me go there, is right here. Who do I have to offer coverage to? So see, this is even a whole separate issue. I might determine that I am an applicable large employer. I've got over 50. Or guess what? I'm not even an applicable large employer, but I'm offering coverage. I might be like KHI, and this small group you might be working with is small, and who do I have to offer coverage to, right, to be compliant? So it's any employee, of course, that's considered full-time for a calendar month, averaging, and we know this one, 30 hours a week or 130 hours of service in a calendar month. And then how do I determine who is full-time, right? And when do I have to offer them coverage? And this opened this whole can of worms, which again, it goes back to this is so complicated for employers to try to implement, which we'll talk later about legislation that's trying to get rid of employer shared responsibility and the individual mandate. So just think of the ramifications when legislation happens. All of this little domino effect will potentially happen. So this whole, okay, if I have a person that I just hire and I have my new hire waiting period, which I know you guys all know, I didn't put it on there, but it's 90. We know that note cannot exceed 90 days from date of hire. So I've got my little new hire waiting period, and then I offer them coverage. There you go, easy peasy, right? But what happens when I've got somebody, and it goes into detail about if they have been part-time and they move to full-time, or if they've been seasonal and they go to full-time. And then, so they've created these guidelines that call it a look-back period. a look-back method, if you will, where they can have a measurement period, a stability period, and an administrative period. And this is a compliance issue. And this is the other component, that once ADP is implemented inside of a business, that they can do all of these things and keep that employer compliant, so that all of these periods of time about when do I have to offer coverage, they'll be alerted based on the tracking of all the hours of these employees, right? So this stuff, this is compliance stuff. This, as well as this is all around. Now this is Department of Labor. This is a Department of Labor issue, because if there's an employee that says, hey, raise their hand and says, I was not offered coverage, right? Then, I mean, I'm guessing that the only way they could do that is they maybe ask their employer and help me understand, and they hopefully could walk them through what this is. But this is where having some kind of a partner or a solution, and I don't care what it is, I'm just saying we've got one to help if you want it, and if not, you can go find your own. But this is where I feel like we need to be there to help our clients know that there are tools out there, and if they found their own, that's great. But this is where they're liable for that penalty if they were supposed to offer coverage to an employee and didn't in the proper timing, okay? And then don't forget that all of this kind of information goes into this, and I'm going to back up a slide, it goes into that 6056, those forms that they have to file. That section, I should say, the forms are called the 1094s, and C's and B's, and there's all more forms associated with these reports. But see how confusing it is, right? I'm sure you're going, okay, Lynn, that's enough. That's confusing. But this is the stuff that if we can direct them to somebody, if they don't already have somebody, and ADP and our partnership will go in and do a kind of a, they'll give them a proposal, okay? They'll come in, they call it an audit. They'll do an audit of their payroll system, guys. And let me be clear here. This is not an audit of, are you an applicable large employer or not? And who are you offering coverage to today, and should you be offering it? They will do an audit around time collection, payroll processing, and then put a proposal together to say, here's what we can do. If we can do the payroll, and if we can do the time card collection rather than the payroll, then we can generate these reports. And oh, by the way, we also give you a dashboard to show you and alert you on this page here about a full-time employee or a part-time whose hours are averaging more than 30. This is where it'll warn them and tell them you need to offer them coverage, now or next month or whatever it is, okay? So, wow, a lot of stuff. We've got help and support out there. And don't forget, again, about the HR Solutions portal. It is so powerful. It's got so much data out there. And, again, if on KHI's site, if you haven't logged into that yet, it's really, really helpful. So as you can tell, I am happy to be the one to bounce things off of, and I'm doing these calls every month to try to keep everything straight and give you guys the latest and the greatest. But there is a level of knowledge that you really need to know, because when you're out there and that client asks you a question, and it's okay if you aren't sure of the answer, but at least you can say, I understand what you're asking, and let me go back and verify, because let me dig into that one. All of these things continue to change. And then you know where to go to get the information, or you give us a holler. Okay, that was a big section. I hope you found that helpful. So how are you going to market? So here's what I just want you to think about, because now's the time to do it, you guys. When we get into this stuff this fall, we'll all be so inundated. And I've got some dates I'm going to share with you, because you'll know we've got a limited time frame now. And I just feel like we're all finally taking a deep breath, right, from what we just came off of. But if we just keep taking deep breaths and we don't plan ahead, then we're going to be in trouble. We're going to find us jumping right back into the fire again and not having done some of the things that we've wanted to do this summer. So I think about it in kind of a couple different areas, like around retention and retaining my clients, generating new sales, but then also layering product. And you can maybe consider layering product might be also a retention effort or strategy, but I kind of broke it down this way. So I'm thinking individual market first. For those of you that play there, how do you show your value? Do they ever hear from you other than when they call you? Have you thought about a phone call effort out to them to see how they're doing? Remember now, especially because of the opened up AOR rules, especially for Wellmark and probably all the other carriers, I haven't dug down, but we know Wellmark has finally opened that up. If you're not in touch with your client, somebody else might be. So are you telephone calling them? Are you emailing them? Do you have a newsletter that you generate? And I'm talking individual market now, but same question too could be had in the group market. a postcard that you just reach out and just say, I'm checking in. And if you need anything, and maybe you can kind of double up some of those retention efforts with, I'll jump down to layering product. You know, make sure that they've got a dental plan. Make sure that they've, and that, as you know, you've got dental options through KHI for your clients, all ages, all market segments. And vision and accident, some of the voluntary products, accident and life and critical illness. You know, summertime is the time for a lot of families that are in a lot of sports. We've got baseball, and you've got soccer, and you've got all kinds of activities going on and with kids. And those families, I just believe every family ought to have an accident policy that covers all their kids. So maybe it's now a good time to get a postcard generated. Let us know what your ideas are. I'm here to kind of stimulate them and get you kind of thinking, but let us know. Between me and Darcy, our Director of Marketing, we'll help you come up with something in terms of an idea or a unique postcard targeting something. And we've got your list of clients, and so we can kind of help you through that. I'll then go into new sales. So if you're thinking about, gosh, you know, I'd really like to get some new business. Like, it's one thing just to retain the block I have, but it may be not bad to pick up some new opportunities. So be thinking about the current relationships that you have. I just talked to an agent this week that said, you know, I don't think some of my clients know all the other things that I do. How can you let them know you do health insurance too? Because many of you do so many other things. For those of you that do health insurance, think about getting referrals from those current clients, those current health clients. Partner with another agent or an advisor who doesn't do some of the things you do, and they may not do health insurance. You guys, there are more and more agents dropping out of our business because they can't keep up with what's going on and all the changes. And I have to say I love it, because it means the ones that stay here are the ones that are going to get the opportunities. They're the ones that we're going to keep our tools sharp, and we're going to be the ones that are going to be really taking care of our clients. And so why not partner with those other agents or advisors out there? And don't forget about tax changes. You know, I'm going to just tell you right now, on June 8th, we're doing a webinar that's going to pique your interest, I think, on what's going on with tax changes. And that gets people's interest and their attention about taxes, because everybody hates paying their taxes, right? So there's some opportunity there maybe to make your clients aware of some things. And then don't forget about, you know, do I want to do a seminar? So I know I've got some seminars lined up with several of you for this summer, and you know, let me know if you're interested so that we can get those booked before we hit, you know, mid-October, because, or excuse me, mid-August and early September, because then we're going to be all into training and getting certified and all that stuff to gear up. So we've really got to make hay right now in this time of, can you believe it? We're already mid-May, and then Memorial Day is here next week. And then May's over, so we've got June, July, and part of August probably. So time is passing here. So really give some thought. Just block off some time to think about how you want to generate new business. What other kinds of groups do you need to get involved in? Whether it's, you know, I'm going to say it again, but if you are not a member of NAIFA, NAHU, or the Big I, you really need to. And as I said, maybe more than one. Belong to more than one, because you'll also find, and especially in several, you know, different organizations, they don't all the agents. That's where you might find some partners, because not everybody does everything, especially as you start to hone down what you do. So be thinking about that. And now in the group market, some of the same things, but I'm going to throw out some other ideas in the group space. How do you show your value? And we've talked about this at our last conference call last month about benchmarking data and our partnership with David Lind. So we've got, whether it's offering benchmarking data, whether you want to offer to them, offer your client to survey their employees. Maybe now's a good time to survey them and ask them, how do they like their employer benefit package, right? How about compliance? Are your folks in compliance? We had a big talk about that last week too with ERISA Wrap Docs. And what about doing a seminar or a lunch and learn for your clients? Maybe for your clients' employees. Maybe it's around voluntary products, and you're going to bring lunch in and just talk to them about these different policies and get them prepared for the renewal coming up this year, where you might then finally bring in that voluntary product you've been thinking about doing all year. And every renewal you think about it, and then you just run out of time. And then looking at new sales, and again, current relationship. Do they know you do health insurance? Some of the same things. How about your relationships with CPAs? a lot of CPAs get clients coming in, especially their employer group clients, and they're having questions as well on what's going on with the tax changes. And remember, you cannot reimburse individual policy premiums and take a tax advantage as an employer. Do they know this yet? So make sure you're doing that. Some of those same, I have some of the same things down on here, but don't forget too about the layering products. We've got the, of course, dental and vision, disability, life, and then the voluntary products, the ones that just come to mind for me: accident, critical illness. Don't forget about the employer, or excuse me, the employee assistance program. I just call it the EAP program, where it's the employee assistance program offered by the employer. It doesn't cost very much. And in these times with so many challenging life situations where, you know, you've got people with cancer, you've got people that have passed away in families of employees for these employers, and just offering a package like that to give them some place to go, as single family homes and divorce, and I mean, you name it, right? So that's another one. Just don't forget about that. These are, I'm giving you ideas to think, you know, maybe I will do a seminar on that for my employers, or anything, again, that you can provide value, that you're out there staying in touch with them. And then, of course, I'll just end with the ID theft protection, and many people are offering that now. And so if you need access to any of that or ideas, we take some of these ideas, we'll get to Darcy, she'll help you create some kind of a postcard. I like postcards because people look at them, right, before they rip them up or throw them away. If it's a letter, I get a little concerned they'll even open it. But anyway, that's the idea. So let's wrap up here, and then we'll go to questions with what lies ahead. And I'll tell you, this is where the industries that you belong to will keep, and they send us this stuff. So when I try to pull this together for you guys, this is my update on all the information that's going on, whether it's at the state level or it's at the national level. So let me give you an update, as I promised I would, from our last month's meeting, that the Big I, NAIFA, and NAHU got together with the governor on May 5th. And again, I'm just so blessed to be part of that coalition representing you all. So I'm at the table, and we're there in the know of what's going on. And the governor had said, A, we're not going to do anything until we know what the Supreme Court decision is. He had a funny story that he shared in his history about trying to anticipate what a decision might be, what a court decision might be, and you kind of prepare for what might happen, and you spend all this time preparing. And he said you just never know, because in his story, the Supreme Court came down with another option that nobody had even thought about. And so this could happen. And so rather than try to put something together to react to what the Supreme Court might do, let's wait to see what they will do. I was sitting next to Lieutenant Governor Kim Reynolds, and she leaned over to me and she said, I can't believe that regardless what decision the Supreme Court comes down with, if they decide that Iowans are not eligible for the subsidy, I can't believe they won't give us some time to deal with that, you know. And I chuckled with her, and I said, yeah, you'd hope they would. So maybe they would say, we'll give this, we render this decision, but we'll give you, you know, subsidies can remain through the end of this year, and then they'll be done as of 1/1 of 16 or something like that. So more to come on that. We'll be tuned in June, so we'll send you all an email when we hear about that. And then, of course, this whole issue called King versus Burwell, Congress is trying to propose a solution. And it's interesting. It would say something like either, and this was crazy because this is where it started talking about, let's just get rid of the individual mandate. Let's get rid of the employer shared responsibility. And so I will be shocked. I think what we're hearing is the Senate might be interested in doing something, and the House is a little more, and this is at the national level now, is a little more dragging their feet. Again, it's so political, and if we do something that, you know, continues to, you know, support or appear to support, you know, the ACA, people are funny about that. So I'm skeptical that anything is going to be done until we get the Supreme Court decision. So they're trying to get something through, and we're not hearing that it looks favorable to get through. The other thing I want to share with you, and we were at the NAIFA conference last week, Brenda and I, and Jess Patton, as you all, most of you know Jess, he does the continuing ed, and I had invited Jess to come and do the presentation for NAIFA on what's the latest and greatest on the Affordable Care Act. And he mentioned something, and it was just in passing about, and you know how Jess, he's he's so knowledgeable, and he talks about stuff that's going on in Washington, but he called it was the Medicare Sustainable Growth Rate, and there was big conversation, and that all has to do with reimbursements to the providers, and it's all about Medicare. And you might think, Lynn, why are you talking about this when we're talking about the Affordable Care Act? Because because in all of these conversations, and it's impacting the budget in those conversations, but he just kind of threw in there and said that, oh, by the way, Plan Fs are going away in 2020. And Brenda's like, did you just hear what he said? Plan F is going away in 2020. It was like, wait a minute. So I did some digging. I clarified that at our Health Underwriters Board meeting this week, and he said, yes, they're going away in 2020. All Fs will become Gs. Like, oh, okay. And all Cs will become Ds. Okay. And so I dug into that yesterday, actually, in preparation for today. And it really, what it says in there, for them to be able to, remember, it's all around the budget and finances and where we get the money. What they want to do is they want that $147 Part B deductible. Okay, the government wants that money. And so for them to get that money, you got to do away with F, right? Because G would be the next best thing to F, because the only difference is the $147 Part B deductible. So now, could that change before now and 6 years from now? Yes. So I throw it out there, not to scare anybody, but that's what's been passed in our legislation. So it's interesting. So again, not panic. I'm not going to go do a mailer to all your Plan Fs for you and tell them they're moving to Gs. But we'll continue to be diligent in watching to see what else is happening in Washington. The other piece of legislation that they threw out there was to repeal the health insurance tax, also known as HIT. Wow. Okay. So we'll stay tuned, but there's just a lot of stuff going on. It's kind of like I'm not going to waste a lot of time talking about a lot of the pending legislation until something really looks like it's going to pass. Last but not least in the legislation is the broker exchange issues. I don't know if you recall, but when we were in Washington, and this time I was with Health Underwriters, we were talking about the portal, the health@care.gov, both for the shop and for the individual marketplace. It's just horrible for us, right? It's not broker friendly. And so we had a list of things, and we put it in the form of a letter, because it really is not going to take legislation to change health@care.gov, but we do need to get those issues and top priority to Health and Human Services. And so finally the letter is off to HHS, and it had like a ton of people signed it. So that's what our ask was when we were in front of those. And for those that are, NAIFA, I know, is doing a fly-in really, really soon here. If not, it might even be next week, I think, because I know Marty, I think you're on the call this morning, Marty, and I think you're flying out there because I was going to come visit with you. So I think it's next week. So good luck, and we'll get some more updates, I'm sure, once that fly-in happens as well from NAIFA. So interesting things, but stay tuned, too, on those issues, and hopefully by this fall, some things will be fixed. They talked about a broker hotline for us when we have escalated issues, instead of just dialing in and sitting on hold to wait and talk to one of those reps. And they talked about a login broker portal, so we'll see if some of those things get fixed. A couple other things that lie ahead, and that, as I said earlier, we heard that United Healthcare in the individual market it says right now they're planning on coming in. It sounds like that's their intention. I've reached out to my contact at Golden Rule from a GA perspective, and we've had their products. We've still got their products, but it's kind of resurrecting that relationship again, because since they left the individual market for, the I'll call them the ACA, individual plans, and all they really have left are the short-term policies. They've got a couple other things that they're marketing, some dental plans, et cetera, but we'll resurrect that relationship, and more to come on that for you guys. And then we hear rumor of possibly another competitor coming into the individual market. I have to laugh because yesterday I was down with some agents in their office and telling them about some of this, and the response, and maybe it was just your response, oh, great, another carrier, another set of products to learn. And I have to laugh because that might be your initial response, but as you know, a competitive marketplace is good for the individual, for our clients. So it does mean more due diligence on our behalf. And this is where I'm also going to challenge you guys, and many of you have done this. You have identified people inside of your office, or you've hired that expert. Maybe you do more group than hire somebody to help with individual. Maybe you do individual, but you've hired somebody to just focus on the Medicare stuff. So you've split it to under and over. So be thinking about those kinds of strategies, and if you want to visit about that, that's what I'm here for. And so reach out to me. And then self-funded plans. Remember, if that definition for small group goes to 100, I think we might see, and that's why we've done these webinars, we might see more interest in self-funded plans down for these smaller groups under 100, maybe as low as 25, but for sure in that 51 to 99 market. So that's why we've had all 3 webinars now. We've had United Healthcare, we've had Coventry, and we've had Wellmark give us their pitch on their self-funded plan. What is it? How low does it go? You know, what are some of the interesting things about it? So those are on our website under the carrier specific, and you can go back and take a look at those. But I think those could get really popular depending on this definition of small group. And then how about new processes? I know at KHI we're continually trying to look at offering, they're streamlining our processes rather, and trying to offer you guys better response rates, more efficient. As you guys know, we rolled out our service teams. Karan and Sarah are really, in this service team, what we're trying to do is put that kind of service issues to a team of folks. And so we generated an email address unique for individual or group service. And so you can see it on our website. And actually, I can give it to you. I think I've got it right here. It is, and I'll just tell it to you. And if you can type it in once in your Outlook or whatever your email platform is. But for individual, it's KHI Service IND at KHISolutions.com. I'm just going to say that in, KHI Service IND at KHISolutions.com. That's for individual service issues. And then the group one is kind of identical, except group. It says KHI Service Group at KHISolutions.com. And the kinds of things that you can send to that email, those email addresses, would be AORs, marketplace forms in the individual market, EFT or ACH stuff, notice of death, even new applications that you're sending in, change forms. Okay, so that's kind of in the individual market, and just the kind of general service and issues on individual, under age 65 and Medicare. And then on the group side, this is for existing group policies, not new stuff. So it includes new hire enrollments, employee termination requests, and or changes, group AORs, ordering employee ID cards, group billing questions. So again, use those, and we're trying to streamline. So I'm asking you guys to think about your processes inside of your companies. Think about the proposals that you deliver. Do you want to start showing partial self-funding? You're going to continue to hear more options and choices. And in fact, Nakia and Tricia and Sarah don't probably know some of this yet, but Brenda and I have talked about maybe some alternatives that we're giving to you as we're sending out the proposals, so that you're getting a lot of information, and then you can decide what you want to put inside the actual document you show to the client. And then the prescription drug plan process. This is maybe going back to, I'm just going to go back up to the slide here that talks about in the individual market and retention. Maybe this is under that retention and how do you show your value. Maybe this is a letter that you're going to send to everybody, and I'll go back down here, to say, hey, here's the scope of appointment. And by the way, we just learned if you play in that Medicare space, we're really encouraging you to use Wellmarks for Wellmark products, and then you can have we have another one that you can use for UHC, Coventry, and Humana. And by the way, we offer all those through KHI, so if you want to get contracted for any of those, see Nicole. But that scope of appointments, put the scopes in there, and then put this drug list. And we've got these now out on our website under our marketing tab in the over 65 market, because if you can, we've tried this process and it works, and you mail that out to them, and then they would send that back into you, and then you call them to make the appointment. Because if you've got 100 of those, how are you going to get those all in and processed, and also be proactive so that they know that you're here for them instead of waiting for them to call you. So hopefully all that makes sense. Remember, jot notes here, and I know we're running out of time, but last, I think this is it. I put play golf, ? These are important dates, and also playing golf is very important, yes, for some of you, not for all. But think about this now. In June, your Wellmark appointment certification will begin. So you're going to get golf in there. And by the way, we're not having an annual golf outing this year, but I'm going to come to you. So if you want to play golf, will you send me an email and say, Lynn, come and play golf with me? Some of you I've already talked to, but I will come and we'll play golf. But we've got June, July, and then part of August, I think, to get that in. So send me an email. We'll figure out how we're going to work that in. Your Wellmark appointment certification, remember, that's just to maintain your appointment with Wellmark. That's going to happen between June 15th and July 15th. And then in July, that's when sub-retail agencies have the ability to move between GAs. And we're happy for this because we hope that that you're pleased with the service you get from KHI, and maybe you'll tell others that you get great service from KHI and maybe they should try it. And this is a refer an agent program we've always had. It's $500. Now, we do have some caveats on that. If somebody doesn't have more than X number of policies, we won't pay it, because if they just have 1 or 2 policies, I got to tell you, especially if it's Wellmark, they're going to get terminated. So, but for those folks that are serious about health insurance and they play in this market space, and they probably have a block of clients, more than 10 or 20 clients. And then August is the Wellmark survey to you guys on how we're doing. Please complete it for us. There's financial, they've taken money away from us and we have to earn it back, and this is one way for us to earn it back, is to have you guys complete the survey. So we really appreciate it, and we want your feedback anytime. So please let us know how we can improve and do better. And then September, classroom training, certification, and you're going to start getting group renewals. I mean, it's just going to hit like a train wreck here again. So let's make hay while the sun's shining in June, July, and August, and just reach out. What else can we do for you? Just let us know. And as always, shoot me an email or give me a call or shoot me a text. All right, let me open this up now. I know I really ran long today, and I apologize, but hopefully that was beneficial to you guys. And I'll see now if you have any questions, and it looks like we do. So let me open this up here. And it looks like our first question is, do we certify every year to sell on the Federal Exchange? And, I think so, and maybe somebody in the office at Fort Dodge can chime in if I got this right, because I think that we need to. I think that I'm trying to remember if we just have to go in and click and go, yes, I'm still here, or so let me table that one, because I want to get confirmation from one of the staff in our Fort Dodge office. So see if somebody jumps on, can answer that question for us. And then this was, refresh my memory, grandmothered plans started when? Okay, great question. So the 3 groups of plans, we know grandfathered plans are those that have not made changes or very small changes since March 23rd, 2010. And then everybody else that had made changes was considered grandmothered. And so you're grandmothered if you have not made changes, dramatic changes, again, to your plan effective January 1 of 2014. So kind of picture that window in between March 23rd of 2010 and January 1 of 2014. Those predominantly are going to be grandmothered plans. And then everybody, of course, after January 1 of 2014, only thing that could be sold new were ACA plans. And then another question here is, can KHI create a cheat sheet which lists the required testing for each area, i.e. Part D, regular Wellmark products, etc.? That's a great idea, Mark. I'm taking that down, and I know we've got Fort Dodge folks on the phone with us, so we'll take that down to create a cheat sheet for you guys. Great idea. Got it. Thanks, Mark. And then is Darcy in the Fort Dodge office? She is not on the most recent contact sheet you handed out at the Wellmark meeting. Great, great point, Allison. Darcy, actually, we contract with Darcy, and she has her own business, but we contract with her to help us and help our agents. So she actually has her own office in Webster City, but we do have an email address for Darcy, and I'll make a note, too, that maybe that would be something that we should be adding to our contact sheet. And her email address is literally marketing@khisolutions.com. So if you just use marketing@khisolutions.com, that'll go to Darcy. And otherwise, you can get a hold of me, too, or any of the staff, and we've got her phone number. But you can, just use us, and we'll get a hold of her. But certainly you can shoot her an email. What we try not to do is have you guys necessarily inundate Darcy. So if you go through us, then we can decide what needs to go to Darcy and doesn't, because we only, we contract her with so many hours a month, and so that's kind of why. But marketing@KHI Solutions will go directly to Darcy. Okay, and then Tuesday and Wednesday next week. Thanks, Marty. Safe travels, and he'll be out in Washington, and anxious to hear that feedback on what the status is of what's going on out there. Nothing like being eyeball to eyeball with them. Good luck. And then is Medica a UHC plan? I who announced Medica coming to the marketplace. Okay, yes, thank you. So Medica, and this is so interesting, and we haven't figured out from a KHI perspective, is this something we should be offering? Because listen to this. So Medica is the nonprofit arm of United Healthcare, or it's a nonprofit company with United Healthcare is behind Medica, because in the state of Minnesota, where United Healthcare is headquartered, Minnesota's law says that they will have no insurance companies that are for profit. So all insurance companies in Minnesota must be nonprofit. And so United Healthcare created Medica, a Medicare supplement company that is nonprofit. So we're hearing, yes, that Medica is coming to Iowa. And so you'd scratch your head because today we represent at KHI of many of our carriers, right? One of them is United Healthcare's AARP Medicare supplements as well as their Medicare Advantage. So we have yet to see, is Medica just a MedSup? Is it MedSup and Med Advantage? Does it have a Part D? We don't know yet, so thanks for the question, and we're looking into that as well. And so yes, Medica coming into Iowa, owned by UHC, but not to the marketplace. So senior products only, and we have yet to find out. So more detail when we get it. And thank you, Sherry, for that feedback. Sherry just says, good job. Lots of information. And let's see. And there we go. Thank you, Brenda. Chimed in and said, yes, you do have to certify to sell on the exchange every year. And then let's see. Paul has a link here. And it looks like President Barack Obama's home state of Hawaii is shutting down its state-based healthcare exchange. All right, hot off the press from Paul. Thank you, Paul. And there's the link. You can, I'm sure, if anybody wanted to see that, Google it. Paul has sent the link out there. It's on, looks like cnsnews.com, and then a news alert. So I'll tell you guys, goodness sakes, yeah. That's, you know, there's speculation about this thing is just going to fall on itself. It's just going to implode, and we don't know that, and I don't talk a lot about that. We hear what's going on around us, but all we can do is deal with what we know today. And as you know, we've all been through our issue with Co-Opportunity leaving the market, and that was bad enough. So yeah, okay. What other questions? That was all great stuff, you guys. Great questions. I'll just see if I have any hands raised, if anybody wants to try to ask a live question. And I'm going to try to, Paul, I see your hand raised. I'm going to try to unmute you and see if that, let's see. There we go. I got you, Paul.
Oh, I'm sorry. I was just trying to get a hold of you earlier to let you know, to ask that question about grandmother plan. You already took care of that. Thank you.
Okay, you betcha. All righty. Well, let's see. I'm just seeing if I've got any other questions or comments anybody wants to make. Wow, thank you guys. This was really full day, and I hope, yeah, it sounds like that it met your needs because I feel good about it. I just thought there's so many things I want to make sure you guys know. So thanks so much for tuning in. Have a wonderful Friday and a wonderful weekend. And if I don't talk to you, have a great Memorial Day weekend and drive safely wherever you may travel. And we'll look forward to talking to you guys all again real soon. Take care, and thanks so much for your business. Bye-bye.